Freedom HealthWorks is the direct primary care accelerator. We help doctors across the country start fresh in direct primary care. With Freedom HealthWorks, you work with a team, not a checklist. Visit freedomhealthworks.com and together we can achieve true freedom in direct care.
That was new. Hi, everybody. Welcome to Healthcare Americana. I am your host, Christopher Habig, the CEO and co-founder of Freedom HealthWorks. Today, we are talking to manager and lead physician, Dr. Jared Wallen of the U and We Urologic Surgery and Wellness. Dr. Wallen, welcome to Healthcare Americana. It's a pleasure to be speaking with you today. And I know everybody out there is going to start off and say, did Chris just say U and We Urologic Surgery? Where did that name come from?
Thanks so much for having me, Chris. The name itself, ultimately, first of all, you are our number one and we are here to serve you. And so that's what all businesses should be about, their customer. And so that's where the first part of it came from. Obviously there is some underlying, urology stuff in there. We do certainly deal with the male genitalia and obviously we is kind of a slang term for urine. Also on top of that, it's also an acronym. So my specialty is general urology, but also men's health specifically is what I really love doing. And so the Y is youth, or essentially kind of, I do hormone replacement therapy for both men and women. And to a large degree, I think hormones can be a way to kind of preserve our health naturally or more naturally than some of the synthetic pharmaceuticals that are out there. The O and U is outpatient urology. The W is wellness. The first E is aesthetics and what have you, because I do certainly do some, kind of aesthetic type procedures and offerings. And then also, obviously, the very last E is a big component of our health as well, which is eating our nutrition, right? And so that's kind of where the underlying name came from.
How long did it take you to come up with that, or that just hit you in the middle of the night? And just bolted you awake?
It really kind of just hit me. I mean, I was kind of just looking at, how I can, number one, profess that you as our client are our number one, and we are here to serve you, was kind of in the back of my mind for starting any business, but certainly for a business that it deals with someone's health. And so from that standpoint, I just kind of started looking around and I was trying to figure out, different ways I could put something together to, kind of create the acronym that we did. And then actually it's kind of funny because if you Google You and We on Google, it comes up with all kinds of urology stuff, which who would have known, right? And so, and now obviously we're also listed there with that. So I can't say there's any one specific thing that brought it about, but it kind of just hit me and I was like, this is great. And the other part about it is that, for the same reason you're interested in it, a lot of people see it and or hear it and they smile. And so as a business, if I can have you in a happy state where you're smiling before you ever meet me, that's a great start for me. That's a great first impression to a large degree. So, that's kind of how we came about with that.
Well, at that point you hit on too, that first impression of a patient or a customer is very, very important. And that's something we try to drive home when we talk to doctors about opening their practices, and a lot of people get wrapped around the axle on, well, I didn't even think about what my name, the name of my practice should be. And then here we are, you can get a little creative. Just make sure it means something to you, right? And you're able to talk about it eye-catching. Don't make it a huge 20, 30 character long web address. But so
Right.
Your story, it's one that we've heard a lot, but the difference is, again, hitting upon this theme of specialty care and non-primary specialty care. You're a urologist.
Yep.
Doing a lot of cool things. Now that you have left hospital, starting up your new practice, and then, kind of to foreshadow the episode a little bit, very soon looking to get into the direct care world with your practice, but it sounds like you're going to walk before you run. And I'm sure you already know my thoughts on that, so I'm not going to even go there, but you got to do what you got to do for your career and for the family and everything. So tell us a little bit about your journey on how it came to this point and how you're one of the very few people out there, urologists, surgeons, even, who are looking to make a impact in the cash pay world when the time is right.
Right. So I guess that takes me back all the way to when I was born. I mean, I don't come from much. I was born in a small village, actually, of 6,000 people, not even a town. My parents are both blue collar. You know, between college and medical school, I leveraged probably close to $500,000 of basically my own money to get trained, right? And then, you know, luckily got through and got to urologic surgery training and got finished that and board certified. You know, but after training, I you know, took a job with a hospital, and for me, I always kind of had some business sense and savvy. I was a manager at a store before I ever went to medical school, and so there was that underlying entrepreneurial spirit there. And I kind of had the goals to, you know, open my own small business and be able to serve and help people. And, you know, I think unfortunately, a lot of that in this day and age is essentially kind of squashed by big business, big corporations, both from a standpoint of independent physician practices, which for folks that don't know, what 8% or 16,000 physician practices actually closed last year during 2020 and everything that went on and what have you. And more private equity firms, big hospitals, big insurance companies are buying out physician practices and basically making them employees, which, you know, to a large degree, you lose autonomy, you lose control, you lose the ability to, you know, maybe work with a patient and you know, kind of cut them a huge discount or what have you if they really can't pay, or work on like a payment plan.
Mm-hmm.
You lose that autonomy of your business, and so that's really something that I experienced pretty significantly in my hospital employee days, is that, you know, I really had no control. And even though there's a book written by Josh Kaufman, it's called My Personal MBA. And there's a quote in there, and this quote is not, at least in his tense, is not directed towards medicine, but I think it applies very well. And the quote is this: it's administrators should not be making the tough decisions. The experts who know the most about whatever subject matter you're talking about should be making the tough decisions. And so, you know, when I see that to me, I'm an expert in medicine, I know business, and I'm the one that knows what's best for the patient. Yet, unfortunately, in corporate medicine, physicians are not making the decisions. It's unfortunately business types and what have you, administrators, that are making a lot of the bigger decisions, but they also make a lot of decisions that affect everyday practice. And unfortunately, they don't see the downstream effects that has on patients. And so from that standpoint, you know, again, being a very highly educated person and yet not having much control and seeing the downstream effects myself of what happens with patients and how they're negatively impacted, and really not having much recourse to try to actually change that,
Mm-hmm.
is quite honestly, a lot of folks will quote it as kind of that one of those impetuses for burnout. I really kind of hate that word, to be quite honest with you. I think it's more moral injury, the way that I would phrase it, because for me, again, as somebody who's trying to be as altruistic and serving as possible for someone, and yet I have no control, and then I have to deal with the ramifications of the negative impacts of what the decisions that are made are, that's pretty tough to stomach at the end of the day. And I think that's the biggest thing where you see there's a lot of physicians that are not happy in corporate medicine and what have you.
Yeah, there's a lot of angst out, anger, frustration, depression,
Right.
feelings of, well, I can't do anything about it, so I'm just gonna keep going to work and kind of grit my teeth and just bear it. Wanted to ask you, you mentioned that you had a business background before, and everything you just said, choosing to go into medicine after having, you know, a separate career or separate jobs. What was that like, and what made you decide to go back to medical school and be a physician after experiencing, you know, kind of that business world?
Right. So, you know, I was actually, unfortunately, actually had to accept my dead cousin's diploma at our high school graduation. He took his own life, had struggled with bipolar and some other psychiatric issues. And quite honestly, that was really when I kind of decided that first I thought I wanted to be, you know, a psychiatrist, psychologist to change people's lives that way and help those folks. But I realized, you know, through my process of college and even into medical school and such that, you know, I was really more hands-on. The surgery was more appealing to me and what have you. So I kind of pivoted a little bit there. But, you know, to a large degree, I think that was sown pretty early that I really wanted to help people. And you know, the business experience was more kind of along the way throughout college too. I mean, I was in kind of a student leadership position within the campus recreation facility within the aquatics department. And I was also, you know, essentially a manager of or an assistant manager of a store while I was doing community college, because the unfortunate part about, you know, accepting your cousin's diploma because they can't be there with you, you know, that put me through a pretty decent loop as a young man. And so I did do a couple of years kind of at a community college to kind of sort that out a little bit and also try to figure out what the heck I wanted to do with my life. And so while I was doing that, I also, you know, was working as an assistant manager of a store, running operations and that type of stuff. And so I guess it was always in the plan. And actually they even asked me, you know, a couple of times to take over stores and that type of stuff. And I was like, nah, I'm going to medical school. This is really just kind of a bridge for me. But, you know, so I guess it wasn't really necessarily I'm in business alone and then I'm pivoting back. It was kind of part of the path, the stepping stones for me to get there.
Gotcha. And it's amazing. So how much of, you know, what we were just talking about a few minutes ago, really, and I'm with you, I don't like the term burnout. You mentioned that you call it moral injury.
Right.
Frankly, it's workplace abuse in any other industry. I mean, I tell this to people a lot, that if we put the constraints of hospital systems on their employee physicians and made them do what they're doing, follow through with that volume, and you know, it's workplace abuse. I mean, it's emotional at times, and that's why we see suicide rates from physicians and medical school students. You know,
Right.
You want to be competitive, yeah, I get it. You want to be the best, I get it. But like you said, you know, you mentioned that the highly educated people want control, be able to making their own decisions. I would counter and tweak that just a little bit and say that it's not just highly educated people that are physicians. It's always it's very empathetic people and people that you're the end of the line. When you're talking to somebody and they just got a cancer diagnosis, they're looking at you to make that call. Doc, what should I do? Right.
Right.
And then if you have somebody second guessing, you know, from an insurance company or a pre-authorization or a hospital system, you're like, well, what the hell? Why am I even here? Why did I even do this? When,
Right.
you know, somebody with their GEDs over here are going to say, well, that's not according to our spreadsheet. It's not according to our protocol. So knowing that, I mean, did you have any idea that's how medicine was practiced when you still were pursuing your dream on going to medical school?
You know, I have to say I was ignorant to how that worked, to be honest with you, and to the severity of it. I mean, you know, for me, you know, one of the things that happens with those authorizations, those denials, is what they call a peer-to-peer. You know, quite honestly, I will tell you that whenever I've called an insurance company, I've never spoken to another urologist, and most
I
time
doubt you ever will.
it's a pediatrician or a primary doctor, which, listen, those folks are great and they do what they do, but there's a reason they didn't get trained in urology, right? And so same for me. If I was on the other end of the line from them calling, I wouldn't really know what's the standard of care for their specific specialty, right? And so
Sure.
not only that, a lot of times those folks aren't even licensed in the state that you're calling from. And so they haven't seen the patient, they've never talked to the patient, they don't know what's really truly going on. All they know is what's on paper. And then, like you said, they're basically kind of following a script of what they can and cannot authorize. You know, that's something that was certainly a curveball for me, for, you know, truly trying to, you know, advocate for the best for my patients and get them the best possible care. You know, again, I mentioned even as a young kid, when I was really considering this, my goal was always the highest quality, lowest possible cost care that I could possibly provide, right? Because, you know, I mean, there's 500,000 people in the United States that go bankrupt, at least in part or wholly due to medical bills a year. And actually, unfortunately, 60% of those have insurance. And so, that's crazy to me that people can't get the care that they need and find some way to survive that financially. It's a shame. And so, yeah, that was certainly a curveball. I was definitely ignorant about the outside control of what I would be able to do for people.
Now, I'm trying to figure out the right way to ask the question, because I'm curious on this, because what you just said, you want to provide the highest quality care for the lowest of money. I think every physician out there should know exactly what their care costs and what their recommendations cost. If you don't know that, you're going to be part of the problem, doc. I'm sorry, but that's just the way it is. Right. What was your experience when you were asked to do a lot of different things in the hospital setting? And those two, I'm going to call it kind of your medical ethos, if you will. What happens when you look at those saying, these are getting violated? I need to talk to my superiors about this.
Oof. Well, I'll tell you what happened in my experience. My experience was that, when I brought these things up, they didn't happen. Nothing really changed. Again, I was a part of a startup practice. They didn't have a urologist there before me. And so unfortunately, with the multiple layers of corporate bureaucracy, I mean, decisions were being made 6 months down the line from when they actually needed to be, when I actually brought them to the table. Right. And unfortunately with that, especially as a startup, you can't change 6 months later. You have to change by the day, by the minute, your policies and procedures. And unfortunately, again, that's part of the corporate problem of medicine, is that that's not really a possibility, at least in the setting that I've experienced. What I can tell you is that a lot of times you may hear about, I don't know, disruptive physicians or what have you. And unfortunately, remember, HR for corporations is really meant to protect the corporation, not necessarily the employees. And so you start ringing the bell and kind of bringing out these problems multiple times over and over again. And unfortunately, a lot of times you get sent to HR and basically kind of, they make you the problem rather than actually addressing the problems that exist that are harming patients out there.
Well, now I'm curious, what was your experience like saying, hey guys, we have a whole problem here. How do I handle this situation? Because I think we could be doing better. And they say, oh, Doc Wallen, you're going to HR. Who do you talk to in HR? Like, how does that conversation go?
Oof.
I'm really curious about that. I'm like,
yeah. I mean, again, unfortunately, it's another administrator, right? And so, ultimately, thankfully, I had a couple of good lawyer buddies and kind of ran it by them when I was going through that, and I was just like, it's sad, but this is where, again, unfortunately, the corporate structure of medicine, to a large degree, silences physicians, right? I mean, I think we've seen that throughout, even big tech kind of silencing physicians this year or this past year and what have you. But even the corporate structure, basically I was advised to bend the knee and apologize and basically make it right, but then essentially kind of find my exit strategy and get out of that system, right? And so, unfortunately, again, if you meet their strength with trying to go against your strength and not, kind of bow down and do what they want you to do, unfortunately they'll find a way to replace you. And that's true for any corporation, whether it's medicine or not, right? I mean, ultimately, you look at like Robert Kiyosaki and some of these other...
Listen, learn, know. Healthcare Americana is a podcast for the 99% of people who get healthcare in America. We're not clinicians or policymakers. We're patients and caregivers, executives and advocates who are fed up with the status quo and have a desire to change it. We produce a weekly podcast that brings listeners backstage at innovative organizations across America that are putting patients first by delivering exceptional care to anyone and everyone.
And some of these other, kind of gurus in business and in the business type fields, they always say as an employee, you're disposable, and any day a corporation can replace you and and move on. And that's also true for physicians that are employees. So, unfortunately, you kind of just basically have to kind of stop complaining. And that's where you kind of said, earlier, kind of when we were talking about the moral injury, the burnout, you kind of just have to accept it. And unfortunately, especially with the amount of people that have significant amounts of debt for their education that become physicians. I mean, I think 40% of folks that graduate med school have greater than $200,000 in debt, at least.
Mm-hmm.
And so, obviously you can't just say, oh, I'm just going to walk away. And you have to figure out some way to take care of your family and pay the bills, and just like anybody else in the country. Right. And so, those are all things to think about for sure.
The thing is, and I'm a firm believer that the status quo in healthcare, everybody is so entrenched that they are fighting any type of innovation and improvement. And that's what, I just heard you say, is that when you as a physician, as a surgeon, bring up an idea on a way to lower cost or increase, the ability, the level of patient care you're able to provide, and you get shot down, vilified, and eventually drummed out of service, I'm thinking no other business in the world is going to function like that. You've got great people working for you. You want them to be able to exercise their creative freedom, find issues, bring it up, and then fix it. So you're always going to be better moving forward. And the exact opposite is what is happening in most of the systems, hospital systems, healthcare systems, in the United States today.
Yeah. I mean, I think two quotes come to mind from very, respected, intelligent people out there. One was Steve Jobs. You mentioned, I mean, he's commonly quoted as saying, I'm not the smartest person in the world, but I employ really smart people that tell me what to do, and tell me how to run my business better and how to make solutions better than what they're doing right now. That's one. The other one, Warren Buffett. I'm sure you're aware of this Haven venture that they've kind of folded now with him and JP Morgan and Jeff Bezos with Amazon and Berkshire Hathaway. They were trying to create some healthcare solutions, what have you. But
yeah,
he was quoted at the Berkshire Hathaway annual meeting directly about Haven as saying that, some of the most prestigious, prominent members of communities are on hospital boards, and they think things are working pretty darn well. Unfortunately, there's a lot of money being thrown around with pharma, with hospitals, with, insurance companies. And to some extent, obviously, those three entities last year threw about $650 million at politicians. So it even involves the government, right? And so it's basically just kind of this big, money scheme going back and forth between all four of them. And folks are pretty happy with the way that's going, because United Healthcare made $22 billion in profit last year. And so, it's kind of a, unfortunately, for physicians, for healers, and even, patients and everybody else that would like to make change, is kind of a David versus Goliath type situation, right? I mean, we can't out lobby them, not at that rate. And so,
right.
At least in
right. I never begrudge anybody for making money and making profit, but it's when you do it in the darkness, in these backroom deals, and you get the government in here to mandate that everybody has to buy this product, even though it's going to bankrupt, like you said, 500,000 Americans each year. I'm like, wait a minute. This isn't how this is supposed to be done here.
Right.
Where's the antitrust here? Where's any type of investigation of this type of stuff? And a lot of times it's profits, the worst offenders. People say all the time that, oh, health insurance should be, we should make that a nonprofit sector. And I'm like, seriously? Look at your local hospital, probably a nonprofit. How happy are you with that? And how much money are they taking out of your pocket? What's going to be better? You ask them what their cash price is. Then you see if you are going to pay that. But there's different ways. And we talked a little bit about this. And just as a reminder here, we are talking to Dr. Jared Wallen of UNW, Urologic Surgery and Wellness, out of Sarasota, Florida. we talk a little bit about the ability of the individual patient to make decisions for themselves. And that is something that we just forget to do, whether it's a doctor we trust or say, give me the best care. I want to make sure that, I prolong life, or I don't have to change any bad habits a lot of times, but I don't care what the cost is. I have insurance. I'm like, what? I don't understand that dependency in where in the world we think that's okay. Is it fear? Is it something else from the consumer standpoint?
I think it's fear. I think it's, obviously everybody is always scared of, I think there was a Gallup poll where something of between 50 to 60% of Americans are afraid of a major medical problem that will, basically kind of either disrupt their financial life or their life in general. And so obviously that's where, kind of this addiction to health insurance, certainly plays a role. Obviously, I think to some extent, Americans don't really also want to pay for anything in the medical system. They'd rather pay for, their pleasurable items out there, things that they want, rather than things that they potentially need. And so, from that standpoint,
but is that because we're so used to not having to pay for it, and somebody else foots the bill and then spreads that around to all the other people out there?
Well, I think it's easy, right? I mean, I think to a large degree, there's a significant lack of financial education in our country, but also even one step further, even worse, lack of financial medical education,
Mm-hmm.
or medical finance education. And so from that standpoint, it's easy to just say, hey, pay for everything. I don't have to worry about it. I don't have to worry about, how am I going to pay for this if it happens, and plan for it in the long run, or how am I going to protect my family and make sure that everybody's taken care of. If all of that is quote unquote handled for you, then you basically have passed that off to that third party. But unfortunately, that gives that third party a huge amount of control.
Yeah.
Obviously, and I think that's part of the problem. From that standpoint, it's unfortunately, it needs to be, patients need to be empowered to understand what's going on. You also mentioned the lack of transparency. Obviously, if you don't even know what your actual bill is until 3 to 6 months later, when you start getting bills, and you can just put a card down and pay, a small fee, and everything will be taken care of,
Mm-hmm.
then, again, that's easy. But if you have to do the work and actually, call and find out about a cash price or what have you, I think that's becoming easier because there's a lot of folks out there that are posting those online and readily available. But I mean, even the executive order that Trump did before he left the office, where hospitals are supposed to be posting prices, I think only about 30% of them in the country are actually doing so, right? Because all they have to do is pay like $120,000, and they can keep their prices hidden, versus the billions or millions of dollars that they would lose by, having to be transparent. And remember,
Right.
whenever, for me at least, what I've learned in medicine, is if especially from the finance standpoint, if something is too complex or hidden, somebody is making a significant amount of profit somewhere underneath that, guys, right? And so,
Sure,
that's
absolutely.
where it's easy, but we need to empower patients to, take care and basically take hold of their medical finance and care.
So you don't think $300 penalty a day for publishing prices? You don't think that's you
Well, I
don't think
mean,
that's gonna do it? Drive the behavior you want?
the CEO of the HCA system made $60 million last year, just himself. So in reference, $300 a day. And actually, I saw something recently. I think in June, potentially, the current administration is actually looking at repealing that executive order. And so, obviously, it just makes things much easier for them to be less transparent. And actually, the article that I read was basically they felt it was too much of a burden for hospitals to have to do that.
Interesting.
Yeah, I'll
benevolent
send it
government,
away.
right? Hey,
Yeah.
Dr. Walden, we're from the government. We're here to help, right? You mentioned empowering patients, and I want to bring that back into empowering physicians to be the decision makers.
Right.
Something that again is a symptom of the problem, maybe an actual root cause of the disease of our sick care system today. Um, Give me your thoughts again, using your past experience from an employed standpoint, and I want this to lead into really why you decided to make that jump into independent medicine, and then ultimately into kicking the insurance companies out of your practice as well, which admittedly is not an easy thing to do for any physician who's ever been in that, and certainly not surgeons, excuse me, in other surgery centers. There's a way to do it, but that's it's all a process. So, what's your take on physician empowerment, being able to call the shots, as opposed to what most employed physicians encounter today?
Well, I mean, I think, going back to delivering the highest quality, lowest cost care in the market, I think that that's the only way. I mean, I think, again, I mentioned $650 million of lobbying to the government from pharma, insurance companies, and hospitals last year alone. I mean, again, David versus Goliath, I can't compete with that. No, even all 1 million physicians in the country can't compete with that, which, by the way, we haven't broached this, but the 1 million physicians in the country make 7.3 cents for every dollar that's spent in healthcare. And
Sure.
so, listen, there's a lot of money going somewhere else. And so from that standpoint, unfortunately for me, that's where, actually I was even going to open a traditional practice independent from the hospital. But I realized that trying to work with these insurance companies was really kind of more of the same. It's a different name on the corporation, but they really, especially for me as a solo physician practice, I really have no leverage to get them to actually pay me what I'm worth and what my value to patients is.
Right.
And so from that standpoint, I think, unfortunately, I've really come to the point that, direct care is the only way, and cutting out the insurance, the hospitals, and the pharmacies, and to some extent the government too, because there's government insurances out there and that type of thing. And really, physicians and patients, and bringing them together is really the best way to get not only patient empowerment, but also physician empowerment to be able to give the best, highest quality care at potentially the lowest cost on the market, or at least the lowest market price that is a fair value for both parties.
What would you say to somebody who comes up and says, "Dr. Wallen, I'm thinking about becoming a doctor"?
That's a loaded question.
Well,
You
I mean,
know,
there's a very popular answer out there.
right. Which I think most people that are my age in medicine would tell you, and do something else, or
Yeah.
what have you. I mean, I think the reality is somebody who wants to become a physician. Certainly, we need more physicians. I mean, there's a shortage, right? And so we need more physicians. We need more residency training program spots, which hopefully they may be making some changes to do. But ultimately, I think going in eyes wide open, most of the stuff we've already talked about, I probably didn't have any clue. And I would bet most medical students don't have much clue when they're starting medical school about a lot of that going into it. And so, from that standpoint, I think going in eyes wide open, and really seeing what you're getting yourself into and realizing that. I mean, unfortunately, listen, there's a growing trend in the country where, emergency physicians are being replaced with PAs and NPs. And unfortunately, there's a lot of emergency residents that are coming out of training and not able to get jobs, or worried about the potential for that to get even worse, as far as finishing all that training. You're talking about 10 to 15 years approximately of training, and however many thousands of dollars in of debt that you've accumulated, and yet then you can't even get a job. So, really realizing the climate that's out there. But I think, again, at the same rate, we need good people all the time, right? And no matter what, we will always continue to need good people. And ultimately, if you have that calling in you, and you can see it eyes wide open, and understand the stressors that are out there, again, God bless you, because we need more and more folks that are ready to take the plunge and fight with us and really fight for patients, because at the end of the day, that's why most physicians I know got into it in the first place, is the patient. Right. And ultimately providing value to somebody else's life is forget about the financial part of it. I mean, that puts you right here, right? That hits me in the heart, is to be able to change somebody's life, especially with a surgery acutely or something of that nature, and have them say, listen, my life is significantly better because you came into it. I mean, that gives you all the feels. I got goosebumps. I mean, that's what it's all about. And so if that's what you're looking for, there's no better way to do it than in medicine. But you just have to be eyes wide open and realize the stressors in the system. Obviously, direct primary care, direct care in general, direct specialty care, I think hopefully will be a huge solution for a lot of the stuff that we're talking about today, and really trying to get back to, again, physicians and patients, because for me, the simplest answer is also probably the most important and most profound, as far as serving someone else directly, and cutting out anybody else that's in the way of, or in the middle of any potential relationship. Because ultimately at that point, you kind of asked this question, I think initially, about, how do we empower physicians? I think you empower physicians and patients together by, allowing them to make a decision together and really not having anybody else influence that decision. Right. And so that's where direct care is exactly performing just that, because your physician can use all the knowledge they have from their brain and their experience and training, and have a great conversation with you and take the time to do so. Because remember, a lot of the way that physicians currently compensate for the low payments that they get from insurance companies is by seeing more and more and more patients, and really only giving you a very small fraction of their time. But in the direct care service, you can spend a lot more time with a patient and really truly get deep into conversation about the options and educate them about what potential there is out there for them to change their life and help them. And really at the end of the day, then they are empowered to make whatever decision they choose for their life. And, you don't have any other third party out there, kind of preying on that.
Mm-hmm. I mean, I was going to ask you, what in your crystal ball, in your opinion, what does a perfect healthcare industry look like from interactions between patients and physicians? But I think you just knocked it out of the park. So, you're either reading my mind or we think alike there. But Dr. Wallen, I wanted to thank you again for coming on the show here. It's been a pleasure speaking with you and learning about your journey. And so we wish you the best of luck here on the new practice coming up. And it sounds like you're well on your way to meeting your professional goals here and really helping people and helping out your community.
Yes, sir. Thank you so much for having me. I really appreciate it. Again, at the end of the day, it's all about the patient and delivering them the highest value care we can possibly do. And, again, I think you kind of highlighted it, direct relationships with patients and physicians and the healing team is checkmate for me. I mean, it's the way that I can deliver the most value and do the most good, while, not having to worry about bankrupting a patient, because if they can't pay, then I can either negotiate and say, all right, I'll write this off or whatever. But as an employee, I can't do that. Right. And as a corporation, I certainly can, and still provide high value care and take care of people, which is huge.
Definitely need more doctors willing to do what you're doing. I think most of them want to do that, but it's the ones going out there and facing that uncertainty and putting their patients first and meeting it head on. So again, wish you the best of luck. That's going to do it for our episode of Healthcare Americana. Once again, I'm your host, Christopher Habig. And as a little bonus here, we're happy to announce that we're launching a new consumer-oriented website called freedomdoc.care. So buzz on over, check that out. Let us know your thoughts. And of course, you can get all our episodes of Healthcare Americana on healthcareamericana.com. And for any more information about doctor and physician resources, visit freedomhealthworks.com. Thanks for listening. Hi again, everyone. This is Chris. At Healthcare Americana, we're always on the lookout for great stories to tell in the healthcare industry. And we'd like to hear yours. Check out healthcareamericana.com and send us your ideas for episodes, or if you'd like to be a guest. Thanks again for listening. Hope you enjoy it.